It's Barbara Melchert, and I'm from the Department of Molecular Pharmacology of the University of Groningen. Today's date is March 30th, and this is a recorded class for the course Pathology and Immunology for first-year pharmacy students. This class is about lung infections. So our lungs are exposed to many threats from the outside, and many of these threats consist of microorganisms, either bacteria, viruses, or fungi. Generally speaking, when these infections stay in the upper airways, they're usually not severe, transient, and don't lead to high morbidity and mortality, and these are very common, but you also can get infections of the lower airways, which then causes severe disease and death. So high morbidity, severe disease, and mortality, death. And since this is the year of the coronavirus, I guess most of you are very familiar with the threat of a viral infection causing severe disease. A question in between: does flu affect the upper or the lower airways? Think about that. Well, the answer to that question is that the flu, influenza, usually causes an upper airway infection, so that's why the flu usually is not a very severe disease. It causes an infection in the bigger airways, so in the trachea and the bigger bronchi, so it's also called a tracheobronchitis. Another virus that can cause upper airway infection is measles, which also affects bigger airways, but slightly smaller than influenza. So it affects the bronchioles, and therefore it's called a bronchiolitis. And another virus that especially causes disease in babies is RSV, respiratory syncytial virus, which causes a peribronchial inflammation. So these are viruses, but they're also bacterial infections, and they're not as common as the viral infections, but the most common one is whooping cough, which is an infection of the bronchi and the bronchioles, therefore a bronchitis and bronchiolitis. Now, flu doesn't cause an upper airway infection, but every year a lot of people still die from influenza. Why is that? Because sometimes the lower airways, so the alveoli, can be infected with influenza, but most commonly people with flu get another infection with bacteria on top of that. So our lungs also have a microbiome, just like our gut has, so there are commensal bacteria in our airways, and when the lungs are weakened by a viral infection, these bacteria can grow out and cause an inflammation or bacterial infection that it will eventually kill people. So other complications, severe complications of infections is bronchiectasis, which means a permanent dilation of the airways. So here you can see a normal bronchus with the epithelial cells here, a nice even thin mucus layer on top of it, and when you get an infection with severe consequences, then somehow the wall of this bronchus gets permanently damaged, so it is weakened, which means that mucus can accumulate here, so it can be seen here better. This is airways, these are airways, and these are walls that are weakened, and mucus is collecting there. And in this mucus that isn't replaced much, because the ciliated epithelial cells cannot get rid of this mucus, because there are not that many ciliated cells here. So this mucus is stationary, and therefore a nice way for bacteria to grow, because it's humid, it's a nice temperature, so you can get bacterial growth here, which can cause even more infections and problems. Another upper airway problem of infections is bronchiolitis obliterans, which basically means the loss of bronchioles through fibrosis. Here again is a normal bronchiole, which is infected by a virus or a bacterium, and then you get an immune response. So there are lots of neutrophils and monocytes coming in, macrophages start helping out, B and T lymphocytes move in, so you get an inflammatory response here. That is so bad that this whole bronchiole fills up with immune cells, and then you get damage to the bronchiole that needs to be repaired, and somehow a lot of fibroblasts then move in and start causing fibrosis. So this whole bronchiole is then filled up with scar tissue, and you basically lose your bronchioles. So here's a picture of a process that can occur after an infection. And my question to you is this atelectasis, bronchiectasis, or bronchiolitis obliterans? And what you see here is a nice airway that is not open and round anymore, but something happened to it. So what happened? Well, what happens was bronchiolitis obliterans, because it should be nice and round. You see some remnants here of the airway, but there's this big blob of fibrosis growing in this airway. So this airway is slowly lost to fibrosis, so bronchiolitis obliterans. So what actually happens when you have a lower infection, lower airway infection? So this could be either a bacterial or viral. And what happens when you have the bacterial infection? So, for instance, pneumococcus can cause a lower airway bacterial infection. You breathe in this pneumococcus, and they get into the alveoli, and they start multiplying, and your epithelial cells will call in the help of the immune system. So there will be lots of neutrophils that come in from the blood into the alveoli that start hunting down these bacteria, and neutrophils can make nets, these extracellular traps that cause a lot of tissue damage, and then there's fluid from the blood going into the alveoli. So the alveoli fill up with a protein-rich exudate and with neutrophils trying to fight the infection. There are also red blood cells leaking from the vessels. So this whole alveolus sort of fills up with something which looks reddish. So that's why we call this red hepatization. Red because it's red, and hepatization because all the air is gone now, and if you would make a section of this alveolus, it wouldn't look like an alveolus, it would look like something you also find in liver. It sort of looks like livers, and that's why it's called hepatization. Hepatis is from the liver. So in a section this would look like a liver piece. So this inhalation of bacteria that usually is commensal bacteria that are growing out in people with low immunity, because they, for instance, had the flu before, and the commensal bacteria think, hey, now is our chance. The immune system of this person is busy with the virus. Or it could indeed be another bacteria that you inhale, like a pneumococcus. So in this stage, the bacteria are being eaten by the neutrophils, but it gets a bit messy, so then things need to be cleaned up. So that's when the monocytes and the macrophages come in. They start eating all the dead neutrophils and all the red blood cells, and they start cleaning this up. So this still means that the alveolus is filled with cells and with exudate, but the red color is disappearing because the red blood cells are being eaten by the macrophages. So this phase is called the gray hepatization, because the red color is going away. And then in principle, when the macrophages are done, then the alveolus is nicely cleared again, and you have a functional unit again. You get resolution of the infection. Of course, there can be complications of these lower airway infections. An important one is pleuritis, which means that the infection spreads to the membranes that cover the lungs, so the pleura visceralis and the parietalis. They become inflamed as well. Or you can have bacteria going into the blood, then you get a bacteremia. And another thing that can happen is empyema or pyothorax, and that is basically pus between the two membranes, the pleura, and where you normally have fluid between them, the pus that is here in these alveoli can leak out between the membranes and cause an empyema. So that is a bacterial infection in the lower airways. But you can also have viral infections. And of course, I don't have to explain to you, because I've already done that in the video about the novel coronavirus. These viruses can cause severe infection in the lower airways. And what happens in such a case is that the type 1 epithelial cells become infected with the virus, and they get damaged, and they basically explode because all the viral particles need to escape from the cells. So you run a chance of the alveolus filling up with blood, because this barrier is destroyed by the virus. So to prevent this, the body makes hyaline membranes that plug the possible hole to the vessels, and to replace all the damaged type 1 cells, the type 2 cells start proliferating. So they cover up the hole as well, and you get immune cells traveling to the walls of the alveoli to help out with the infection. So this all ends with very thick alveolar walls covered with hyaline membranes, and with hyperplasia of your type 2 epithelium. So when you're able to clear the infection, then these type 2 cells will become type 1 cells again, and the wall of the alveoli will be thin again. The hyaline membranes will disappear. You get resolution of the infection, but sometimes, for reasons we don't understand, this is not going back to normal, but you get fibroblasts moving into the walls of the alveoli that start producing scar tissue, and you develop interstitial fibrosis, which we'll talk about more in the video about pneumoconiosis. So this is exactly what happens with the novel coronavirus. It attacks in severe cases of COVID-19, it attacks the alveoli and causes very severe disease. Here a question: which of these two sections shows a lung which is suffering from a bacterial infection? And is that the left or the right one? I'll let you think about it for a minute and then I'll give the answer. Well, the one with the bacterial infection is this one, and the one with the viral infection is this one. How can you tell that this is a bacterial infection? Well, the alveoli are not really visible here anymore. All the alveoli are filled up with immune cells, so all these purple dots are immune cells. Here you see a remnant of an alveolar wall, but it's completely filled up with immune cells, and that's exactly what happens with the bacterial infection. Here you see the alveolar walls that are thicker. You see all this debris here, which are damaged type 1 cells that were infected with the virus and are lost. And these alveolar walls start becoming thicker because of the inflammation that is starting up there. So in summary, the differences between a viral and a bacterial infection. A bacterial infection you can distinguish by alveoli filled with immune cells, while a viral infection shows hyaline membranes, thick alveolar walls, and hyperplasia of type 2 epithelial cells.